The challenges that you're working on are different than the ones that our forefathers worked on. So we have to continue to change and evolve. I was asked to provide a little bit of a history lesson. I think that answer might not be a bad answer, but the reality is we've won many battles against foodborne disease. Here's mortality rates in the 1900s in the United States. It would be true for many countries around the world. What do you see? Illnesses and fatality rates plummeting. What's that one peak there in 1918? It should be top of mind for everyone. Spanish flu, as you think about COVID-19 and coronavirus. I know that the reduction in fatality wasn't all due to food safety. There were advances in medicine, antibiotic, medical treatment, but we know sanitation, food safety, pasteurization, et cetera, played a role. So let me take you down a real brief trip of food safety memory lane. Here you can see in this slide, in 1906, a pretty important moment here in this country with the publication by Upton Sinclair of a book called The Jungle. How many of you have read The Jungle? Very important book in our profession. Sinclair had intended to document very atrocious conditions in meat processing plants in this country at the turn of the century, primarily driven out of a motivation so that workers would be treated fairly. He's quoted as saying, "I aimed for the American's heart, but I accidentally hit their gut," because it documented very unsanitary conditions in meat processing plants. And that was one of the first consumer movements, consumer outrage, that led to the publication of the first Pure Food and Drug Act. You fast forward over a period of time, you can see that in 38, we needed to continue to modernize our regulations. Now this was largely due to some medical failures, once again a consumer movement. Women and moms in this country concerned about medical safety resulted in President Franklin D. Roosevelt passing the Food, Drug, and Cosmetic Act, which eventually gave FDA authority over a large portion of the nation's food system. Continue to look over time, you can see that I like to call the first food attribution studies. A lot of the illnesses occurring in that time in this country were related to milk and dairy products, and you saw states across the nation starting to require producers to pasteurize milk. And by the way, that was very controversial at that time, consumers concerned about pasteurization. Let me fast forward a little bit in time. 1960, we had a real notable development. One of our best risk management models, HACCP, born because of the U.S. Army labs, NASA, concerned about putting astronauts in space and keeping them safe from foodborne illness, coupled with Pillsbury, HACCP was born. And all of you to this day use HACCP principles in the work that you do. Fast forward a little bit more, and what did we see? In the time that I've been working in this profession over 3 decades, it's probably the biggest milestone event of my profession, the Jack in the Box outbreak, where we learned for the first time of this new and emerging pathogen called E. coli 157 that could cause very tragic, severe illnesses, hospitalizations, kidney failure, and deaths. One attributed not very far from where we're speaking today. 700 plus illnesses, hundreds of hospitalization, children dying due to contaminated beef patties. Going on in time, in 2000, all of you know, based on some food scares in Europe, clearly some audit fatigue, but the private sector coming up and saying we need to do more to protect our consumers, GFSI was born. And I think it started a wave of private sector making sure that they had high standards, but also public-private partnerships, which I hope we can continue to build on today and tomorrow. And then last but not least, for us, a really big event in 2011, the passage of the Food Safety Modernization Act, the most sweeping reform to our nation's food laws in 70 years, where Congress granted us authorities that we never had before. Authorities such as mandatory food recall, regulatory agency, if a company is not doing the right thing, we will issue a mandatory recall. Strengthen our capabilities in response to imported foods, produce safety and on the farm. And so you can see we've made a lot of progress. But that brings us to where we're at today, 2020. How do you think we're doing? I heard we might be losing some of the battles against foodborne disease, and we're not winning right now. And you can see we've made a lot of progress. But the reality is, if you look at foodborne statistics over the past couple of decades, what do you see? What do you hear? They're flat. We're not making a lot of progress, right? These are some of the headlines that you see. foodborne illness progress stall. And it's not only unique to the United States, I see these headlines all over the world. That's partly because we're getting really good at detecting foodborne illnesses, tools such as whole genome sequencing. But I think right now consumers might think that we're not really doing as good a job as we'd like to do or we can do as it relates to food safety. So here's the message. I don't believe that what got us here to the year 2020 will be what's going to get us there to the year 2030. And I am more convinced than ever before that this profession needs change. We need change in how we manage food safety. And so that's why, as an agency, we're talking about this new era of smarter food safety. Let me assure you that this new era of smarter food safety is not a tagline or a slogan. It's a new way of working, one that will adopt and leverage the types of tools and techniques and emergent technologies that are being used in society all around us, whether it's blockchain technology, sensor technology, the Internet of Things, predictive analytics, machine learning, AI. I've always said that it has to be more than technology. It's also about people. It's also about leadership. And it's also about culture. Pause to think about this. A lot has changed since FSBO goes past in 2011. A lot has changed since GFSI was born in 2000. Can we continue to do the things the same way? The answer is no. Think about it. I think we're in the midst of a food revolution. How many of you think we're actually in the midst of a food revolution? Look at the hands. When you look at the level of investment and changes that are happening, listen to this. Foods are being reformulated. Lots of foods reformulated. New foods and food production methods are being realized. Afterwards, a respected friend and colleague, Dr. Mindy Bashir, is going to come up and talk how we've partnered together on cell-cultured meats, because it's something that we haven't had to grapple with forever. And the food system is becoming more digitized. The food system is changing very rapidly. And I'm convinced that we're going to succeed in these modern times. We need more modern approaches to food safety. Food safety increasingly, and food safety professionals have to become more multidisciplinary. And we're going to do that with our new era of smarter food safety blueprint. The blueprint will be unveiled very shortly. The reason I'm here is I want to give you a sneak peek. But within the next few weeks, you will see the blueprint come out, again, that will outline a decade's worth of work. And we're not going to be able to do it alone. We're going to need GFSI and all the stakeholders to join us. I do want to share that this blueprint has been a very collaborative process. When I was in the private sector, I could create a blueprint like this in a month, 2 months. I've been working on this for a year. We've assembled some of the smartest men and women within the agency to work on identifying the blueprint. What are the things we need to work on? We knew that we couldn't just solve it with the creative minds within the agency, but we wanted the brightest minds in food safety. So we looked external to the agency, and we held a public meeting attended by 1,300 individuals. We opened the public docket. And so when the blueprint comes out, you will see a very thoughtful and deliberative approach to the future of food safety, and many of you will see your fingerprints in it. The blueprint is broken down into 4 key areas. One, we call technology-enabled traceability and outbreak response. And I'll talk a little bit more about these. Secondly, we'll talk about smarter tools and approaches to prevention. There are tools out there that can dramatically enhance the way you're doing your business. Number 3, we're going to talk about adapting to new business models, because I've already stated the food system is changing. And I'll close with a little bit on food safety culture and the important role that humans play on it. Tech-enabled traceability. A lot of you know that I'm passionate about traceability. I said, today's food system is pretty impressive, but it has one major Achilles heel. I've seen it in every major food safety issue I've worked on, whether it was in the private sector or the public sector. Always a lack of traceability and transparency in the food system. A major Achilles heel. So we're going to work on that. I don't think I have to persuade you that it's important, right? Think back about spinach in 2006. Think about PCA in 2009. More recently, think about romaine lettuce. 2018, large outbreak of romaine lettuce here in the United States. Public health officials, FDA and CDC, couldn't trace back the source quickly enough. And we had to do what you would expect us to do, issue a public advisory. We advised retailers and growers, and shippers, and food service companies to pull romaine lettuce nationwide. No romaine lettuce available. Why was that? A lack of traceability. You fast forward to 2019, unfortunately, there was another outbreak. There have been too many outbreaks associated with fresh leafy greens in this country. From 99 to 2018, there have been 40 outbreaks documented by the CDC involving E. coli strains, sugar toxin producing strains of E. coli. In 2019, what happened? Based on some good work by one state health department and some good work done by one retailer and one processor, we were able to trace back the source real quickly to Salinas, California. That advisory was avoid romaine lettuce from Salinas. You can see how we're making progress. And in the future, we'll be focused on prevention, but if we can't prevent them all, we'll be able to contain them much more rapidly. The FDA will be releasing an action plan very soon on fresh leafy greens, and I ask you to take a look at that. Some of you know the story that I've talked about, a pilot that I worked on when I was in the private sector a couple of years before I joined the agency. And what we did is we took a mango product, very complicated life journey. You can see how it travels from farm to store. I actually asked our team to do a traceback study. They tried to do the traceback study. It took 6 days, 18 hours, and 26 minutes. After putting all of this data on blockchain, we were able to do traceback in 2.2 seconds. That's what we're after, true traceability at the speed of thought. The way we will do that in the new era is through voluntary initiatives, working with the industry and providing incentives. But we will use rulemaking as an approach. And all of you should know that we will issue a proposed rule in September of this year called High-Risk Foods and Additional Record Keeping. So more to come on that. Let me speak a little bit about smarter tools and approaches for prevention. There'll be a host of ideas in the blueprint, but I want to give you one that I'm pretty excited about. I think many of you know Americans expect the foods that they eat to be safe, whether they're imported or produced domestically. In our country, about 15% of the food is imported. It's not as large as people think, but with certain commodities, it's much higher, 94% for seafood. We did a proof of concept where we looked at seafood imports for the past 2 years, retrospective, using a tool that we use, which is called a Predict system. It's a computer system, but we layered on artificial intelligence and machine learning. And we saw and evaluated if machine learning could increase the predictive power of finding biological products. We're going to be releasing that soon, so I can't give you the exact details, but all I can tell you is I am more than impressed. I was blown away how layering on this functionality of machine learning could dramatically improve your predictive capabilities. That's an example of work that we'll do. Number 3, new business models and retail modernization. I think you know the way consumers are shopping is changing. In the near future, 1 out of every $5 spent on food will be done online. That means there's going to be new ways to communicate with consumers, new packaging materials, new needs for temperature control, etc. And we'll work with you and others to define those current standards to make sure that those processes are safe. And then looking at retail, we also know that we need to be focused on traditional retail modernization. In our country, a large portion of the burden of foodborne disease is still involved with retail. And if you look at out-of-compliance rates over decades, what do you see? That our traditional approaches, inspections and training is not working. The out-of-compliance changes haven't changed in decades. So we'll make progress in that. And last but not least, we will make progress on food safety culture. People are surprised that we have culture in our blueprint, but we do. And that's because we realize that you can have the best regulations in the world, but if you can't get people to do them, they're useless. And I like to say that food safety equals behavior, so we'll work with the private sector. If you look at some of the things that have been major issues, catastrophic events in society, and they're studied, what's the conclusion? I have a few here. GM ignition switches, shuttle disaster, BP oil spill. They don't talk about the science. What do they talk about? Culture. And I would suggest with absolute certainty that a lot of the food-borne outbreaks of our day are more culture than they are science. Not salmonella survival and low moisture foods, but a culture that allowed this to happen. A culture that allowed melamine to be inserted in infant formula. Or even with Bluebell that came up today, a company that had never had a problem in 108 years. You think you might be lulled into this sense of complacency? Of course. So culture matters, and we will work with that. Let me close with this real briefly. What I want you to do as you leave this conference today is I don't want you to ask what if, or Frank, but. I don't like the but challenges. I want you to ask yourself, and I want you to think about this word. Imagine. Imagine a world where you walk into the grocery store and you scan a bag of lettuce and you know where it came from in seconds, not days or weeks. Imagine a world where you're concerned about the supply chain. Many of you are responsible for large supply chains. But you start changing and you start getting greater confidence because you now have leveraged artificial intelligence and you feel that you've increased your chances that, like, let's say, no exaggeration, 300, 400% of finding a biological product. Imagine you working in a processing facility or you have a farm and you're concerned about water quality. But right now you know the exact quality of that water because you're looking at your smart device. You've got sensor technology and you say, hey, my controls are in place and the system and treatment is working. See, we're not talking about things that can't be done. We're talking about things that are happening right now in many business sectors around us, and we can leverage them for food safety. Let me close with this. It's a new year, I can say still, February. It's a new decade, but it is a new era of food safety. Like FDA, GFSI will embark on this new era of smarter food safety. Like FDA, GFSI has to adapt to the changing world around us. I spent a lot of time with this for GFSI and the private sector. I'm now spending a lot of time in the public sector. And what's really clear to me more than ever before, my friends and colleagues, is that there's so much more we can do together. Thank you for being here, and thank you for what you do to keep consumers safe worldwide.